Michigan has the dubious distinction of leading the nation in COVID cases. What is happening and what's ahead with winter on the horizon? And as President Biden comes to Detroit to tout electric vehicles, a thorny problem awaits, and once again, it's China. Today is Sunday, November 21st, 2021, and this is Flashpoint. Hi, welcome to Flashpoint. It was another big news week, but right off the top, as we count our blessings this week, let's give thanks for the return of Michigan journalist Danny Fenster. Just as we were trying to absorb the agony of an 11-year prison sentence for an outrageous set of charges, he was suddenly on his way home after some very nifty work by the former U.S. ambassador to the UN, Bill Richardson. And seeing Danny back with his family was a wonderful and warm moment for the Army that had been advocating for his release. Danny, we are so glad you're back. And just in time for what is always a big week in the Motor City, Thanksgiving coming up on Thursday, and with it, the return of one of the city's greatest traditions, America's Thanksgiving Parade. We're back to the real thing, not a virtual edition. But the backdrop is the very worrisome rise of COVID cases again in Michigan. Here we are leading the nation in new cases. What's going on? Well, I've got 3 doctors on call to talk about it. And a little later, it was a big week for the city and for General Motors as President Biden basically christened GM's new Factory Zero plant. He couldn't have been a better pitchman for the new electric Hummer. But a recent New York Times op-ed warns of electric trouble coming from China. We'll talk about that too today on Flashpoint. All right, we're going to spend a good part of this morning talking about the COVID surge in Michigan that has been confounding to many. Our hospitals are again filling up. Somehow we've hit a pandemic high on the metric of the 7-day tracking average of cases. Let's talk about it with 3 men who are living this on the front lines every single day. Dr. Devin Scillian at the bottom of your screen, Chief Clinical Officer of Henry Ford Health System. Up above him and to the right, Dr. Christopher Carpenter is the Chair of Internal Medicine for the Beaumont Health System, and our Dr. Frank McGeorge, our health and medical reporter here at Local 4, and also, of course, an emergency room physician with Henry Ford Hospital. Dr. Scillian, let me start with you. Michigan has seemed to move to the beat of its own drummer through so much of this pandemic. We haven't always been in lockstep with our neighbors or even the rest of the country. Why do you suppose we are now leading the country in cases of COVID again?
Unfortunately, we are seeing a fourth surge that we were hoping that we will never see. And I think there are a number of factors contributing to this. First, the fact that we have a variant at the present time, the Delta variant, that is much more infective and transmissible than we have seen with prior variants. Second, that we have kids back in school. And we know that the number of infections and outbreaks in school have been rising in Michigan, especially that people are indoors. Third, we are seeing at the present time people getting fatigued and lowering their guards. All of us have been out in public and we see people are not wearing masks, are not social distancing. And third, unfortunately, we've not hit the target threshold that gets us to herd immunity with vaccination. We were hoping for 70, 80%, and we are in the mid-50s in Michigan. So I think all of these are contributing to what we are seeing.
Those all seem very plausible as part of what's going on here. Let me move to you, Dr. Carpenter, but I'm not sure any of those are Michigan-specific. Any idea why it's here?
Yeah, I think the factors that Dr. Scillian discussed are important because what they do is allow the spread of the virus. And us letting down our guard, I think, is a very important part of that. But what people need to understand is also the virus doesn't spread nationally; it spreads locally in our communities. So you get a little pocket in a group, and then that pocket can kind of spread out. So it kind of ebbs and flows throughout different communities, and that's what we're seeing right now. We had a good lull kind of towards the mid-late summer, and then as we kind of got together again in schools and other factors that led to that, and then just a few cases become many more cases. And until we kind of recognize that there are things we can do to mitigate this, we'll see this. And the vaccine is a very important part of this, but it is not a perfect solution.
No, it's not. It's certainly still the best one that we have, Dr. McGeorge, and we still need people getting vaccines now. In fact, you this past week urging people to be getting their boosters. But these most recent hospitalization numbers, we see that almost 30% of the people being hospitalized had the vaccine, and I thought that might not help some of the vaccine hesitant to get on board. So can you characterize the people who are getting the vaccine and yet ending up in the hospital?
Yeah, sure. I think that's a really important point. A lot of the people that are ending up in the hospital, even when they are vaccinated, are frankly older people or people with other immune compromised conditions. And in fact, if you look at the death rate among breakthrough cases, it is highest among people that are in the older age group, over 65 in general.
Yeah.
So I think, the underlying factors that put you at high risk for severe COVID are the same, whether you're vaccinated or unvaccinated. Being vaccinated gives you that much more of an edge, though, over being unvaccinated. And so whether you're high risk or not, being vaccinated puts you at a distinct advantage. And that's really why the vaccine is so important right now, regardless of what your underlying risk factors are. But certainly if you have, anything, whether it's age, obesity, hypertension, you name it, you need to get vaccinated because you are at extraordinarily high risk with these high rates of community transmission that we're experiencing right now.
It remains a big problem for people who are unhealthy to begin with, that's for sure. But Dr. Mankara, the breakthrough cases that we're seeing, would you ascribe those more to the Delta variant and maybe the way that it can work its way around our vaccines, or is this telling us more about how long the vaccines last and why the boosters are so important?
Well, I think it's a combination of both. As you have mentioned, 70% of the people who are hospitalized at the present time have not been vaccinated. So we know that vaccine play a significant role in that. The people who are vaccinated and getting the infection, that, like Dr. McGeorge has mentioned, are people who have underlying illnesses, whose immune system is compromised, and this is why they are not getting all the benefits of the vaccine. And there is no question that the data at the present time is clear with respect to the waning off of the effect of the vaccine, especially in the elderly population. What we have seen is that the immune system, the immune defense that's built with the vaccine goes down with time, and this is more prominent in people who are elderly or people who have certain conditions where their immune system is not as strong.
Yeah. Dr. Carpenter, we have seen reticence on the part of the governor and the state. Now, of course, she's also had some roadblocks thrown down in front of her by the courts, but we've seen some reticence to kind of move us back to some of the measures that we were taking early on. And I think some people, like a lot of physicians, argued that a lot of those were effective, and that's how we brought things under control to begin with. Is it time for us to move back to whether it's masking, a vaccine mandate? Is it time to move back to stricter rules?
I think we could ratchet it up a little bit. I'd be very cautious going back to where we were because we saw a lot of consequences from that were definitely unintended, and unfortunately we learned from that. But more community use of preventive measures would be really welcome at this time. I think I've been to some venues where people are just acting like there is no COVID, and those are the type of venues that we will see spread out of. It's challenging to kind of get them kind of to recognize that, and to, again, the simplest thing we can do is wear masks and wash our hands, and people are not generally doing that out in the communities unless the industry, the businesses and other areas are helping them to understand the importance of that. So I think if we could take that step back a little bit and kind of have that masking and other things out there, I think that would help a fair amount.
I think there is such a natural urge to return to some kind of normalcy, and Frank, that includes 4 days hence, when a lot of people will be gathering around their Thanksgiving table. We've got a lot of travel going on, a lot of family will be getting together with people outside their direct households. What's your worry level now, as we're already at this very high level, and now we move into the holidays?
Well, I think, one of the things that you highlighted was that Michigan is on a different curve than the rest of the nation.
Yeah.
So depending on how the mixes go, it could actually spread further across other parts of the country than just right now. In Michigan, Minnesota, for example, is also very hot. But, within Michigan, we are at such a high level of community transmission that even for families that do not live together but are still in the state of Michigan, you should still take appropriate precautions. And that might mean, doing an at-home test prior to a family gathering with multiple families or outside family members. There is a significant level of concern that the holidays, as they have done in the past, can increase the rate of acceleration. And we are already on an accelerated path right now.
Yeah. All right, we're going to take a quick break from our medical school lesson here. We come back, I'm going to ask the doctors about the biggest misconceptions that they're still having to deal with every day. Don't go away. This is Flashpoint on Local 4.